I will be chairing your next session, which is a panel on NCD policy and programming, taking stock and informing priorities, national and regional perspectives. And unfortunately, folks, I'm going to be very hard with you on the time. I took all the time, so now I'm going to be hard. So, yes, we're going to start with, you want to go in this order, right? That's listed here. Okay, so Jamaica, Debbie, you're going to give us a...
Nice 5-minute allocation. Good afternoon, everyone. So I think most of you would have seen our ads earlier in the break, and that is a campaign that I want to speak about now. Right, but I think most of us know the background sugar consumption and its impact on being overweight. With drinking 1 sugary drink a day can increase the likelihood of being overweight by 27% for adults and 52% for children. And our data in Jamaica, 3/4 or more of Jamaicans, 15 to 74, consume 1 or more bottle or glass of sweet beverage a day, and 75% of our boys and 71% of our girls, 13 to 15, have more than 1 soda a day. And the overall figures of obesity in Jamaica, I think we have been discussing this, have increased 76% in 16 years is the bottom line, and 27% of our boys and 33% of our girls are overweight. So this project that we're currently engaged in with funding from Bloomberg Philanthropies is aimed at building public awareness, which we intend to lead to policy change. So the awareness part of it, you have seen the ads that are there in all the various media forms. And of course, we're working closely with our colleagues at the Ministry of Health, with the Minister leading that team, to support our call in keeping with the WHO best buys and many other documents of a tax on sugar with sweetened beverages. We know about the impact of tax on the reduction of consumption from several studies. And also just to point out that this tax on sugar with sweet beverages is mentioned in many, many documents. This will start with the Heart Foundation of Jamaica, or even the Minister of Health or Jamaica Moves. There were many, many documents leading up to this, and I don't even have the WHO best buys was another one. And the campaign is through the TV, radio, billboards, buses, social media, and print media. If you drive around Kingston, one of the big public buses will pass you with our ads on the side. And it's Rosie, that was the name of the character in the first ad, was targeting mainly adults, and we had various formats of the ad depending on the amount of teaspoons. Somebody that works with me at home said she caught her son with a sugary sweet beverage and said, "You know, see what happened to Rosie?" So the name Rosie is like a household name, you know. This one with 20 teaspoons. So we have various variations, and this is our partners at the bottom, the Ministry of Health Jamaica Moves. And this was when we launched phase 2, where we now turn our focus a bit more towards dealing with obesity in children. And we had a school group there with us. And these are the second phase of the ads targeting the children, because in Jamaica we also have bad juice, which is also an issue, and box drinks. So we furthered the discussion to include other forms of sugary sweet beverages as opposed to just the typical sodas. And these are the buses that you will see driving around Kingston. And these billboards are all over Jamaica. Every single parish in Jamaica has 1 or more billboard. Oh, and we also had ads in our the print media. Just to point out that one ad in particular was this one here on the right. We have an open letter to the government of Jamaica outlining the issue of obesity and calling for a tax on sugary sweet beverages, and it was signed by all the leading health NGOs in Jamaica, apart from, of course, the Heart Foundation, Cancer Society, the Medical Association, the Nurses Association of Nutritionists, and so on. So this is an open letter to the government of Jamaica. And we also have ads coming in the newspaper, because we did a pre-campaign survey about the support for taxes, and we found in that campaign that 64% supported the tax, and it went up to 78% if it was particularly addressing obesity in children. These were some of the figures here. So 64% support a tax, and bear in mind this was before the campaign started, and it went up to 78% if the revenue used was went to some child obesity prevention programs. And that 9 in 10 agree that the government must get involved in solving the epidemic of obesity facing us. And just to say, our partners, Ministry of Health, very, very supportive, Jamaica Moves, advocacy, the usual persons that work with us in these matters, civil society, NGOs, the National Food Industry Task Force, chaired by Professor Henry. We work very, very closely with them and make sure that everything that we do is aligned with their objectives, which you'll hear about them, but their objectives are in the field of product reformulation, food marketing, food labeling, and our project will come under communication and advocacy. That's it for now, we can discuss later.
Okay, panelists, that was 4 minutes, okay? So you have your marching orders, 4 minutes.
All right, good afternoon. I'm happy to be able to talk to you a little bit today about the obesity prevention initiatives for Barbados through the HSFB Foundation. We're a little earlier on in our initiative than Jamaica, but we're very happy to have the funding. So we would have also received funding through the Global Health Advocacy Incubator for a project that runs a period of a year. And our project is an advocacy campaign to ban the sale and promotion of unhealthy foods and beverages in schools. We basically focused on the school environment. The HSFB Foundation has a history of providing a service delivery with respect to a childhood obesity prevention program. And in order to leverage that and have a more systemic effect, we wanted to focus on the school environment. So these are our core objectives for our program. Obviously, in order to be successful, we need to work very closely with the Ministry of Health and Ministry of Education, and also building CSO coalitions in order to have a shared voice and consistent messaging as well. And we would want to achieve this as well through regular stakeholder meetings, incorporating all relevant parties. But the idea as well that we want to build public support for policy change in this area. So our initial step in our program would be to build support through the public for a change in policy to ban the sale and promotion. It's important for us to not just look at the ban of the sale, but also the marketing within schools for the children. Big Food are doing their marketing in schools by surveying children to find out what the best burger is, what the best fries are, who has the best drive-through. So we as civil society organisations should also be going into schools in order to ensure that our children have a healthy environment. So we plan to do our communication campaign and also develop strategies that would counter resistance from the fast food industry as well. So not only would we be looking at, trying to remove and ban the sale, but also then looking at alternatives that can be placed into school as well. So you're not just removing, you're also replacing with healthier options. And our other objectives are also, as was spoken about earlier by Prof, whether or not, policy or legislation. So we've started off by campaigning for policy, but with respectively the move then to look at legislative change in order to enforce the ban of the sale and promotion of these unhealthy products. We also have another objective, which in Barbados is to promote a 10% increase in the HSFB taxation to 20%. So while we're doing our work in relation to the school environment, we'll be leveraging that with respect to also promoting an increase in the HSFB taxation as well. We also wanted to mention that we do have, through the Healthy Caribbean Coalition as well, received funding to specifically look at the ban on provision of SSBs in schools, in and around schools. It's important not just to look at the enclosed school environment, but the surrounding environment as well, with the vendors. So we wanted to look at an encompassing project with respect to the total school environment and surrounding environment. So this is just a summary of the objectives from that project. which looks again at communication plans, but also specifically looking at community-based interventions, looking at the grassroots levels interventions that we can use to highlight health promoting schools, which schools actually have initiatives that are health promoting at the moment that we can showcase in order then to leverage that for the ban of the sale of unhealthy products in schools. The other main objective for this project as well is to form a coalition, a national coalition for childhood obesity prevention. So we can't do this by ourselves. The Heart and Stroke Foundation is small in Barbados, so we will need to be working very closely with all our stakeholders. And as discussed before, Ministry of Health, Ministry of Education, Trade, Culture, Youth and Sports, Ministry of Finance, local and regional CSOs, Healthy Caribbean Coalition, also Research Centre, the George Allen Chronic Disease Research Centre. We're working closely with them with respect to a project with the same childhood obesity programme. And also then, on the other side, we have the fast food industry, manufacturers, and of course, we need to work with school boards, principals, and parents, and youth advocates. So, for the Heart and Stroke Foundation, our initial steps have been taken with respect to this capacity building. Heart and Stroke Foundation of Barbados has been for a long while a service delivery CSO. So in order to then move forward with these projects, we've had to look at our capacity. So we have brought on a project manager, we've brought on a communications officer through the funding, we've also got services for website design, social media, etc. We've been training our volunteers, and the next steps now for us are obviously project execution. So our key next steps would be working with our stakeholders, formulating our CSO coalitions, and moving forward with our communications plans, but ensuring that we're working collaboratively with multi-sectoral and multi-stakeholder approach. So thank you.
5 minutes and 2 seconds. Okay, Karen, are you next? Yes.
Well, I'm the first presenter on this panel that has not received any funding from the Bloomberg Foundation. And therefore, in fact, there are even more relevance of working with the resources that we have in Trinidad right now. The Trinidad and Tobago NCD Alliance was launched formally in March last year, but in fact, we've been having discussions over almost a 2-year period. I'll share with you that notwithstanding the fact that among the founding members are organizations that have, including on some of the oldest organizations, they have not had the practice of activism as we've had in the HIV sector and other sectors. So that's part of the learning process for us as well. We work coordinatingly for advocacy for development and implementation of multi-sectoral policies, monitoring and evaluation and implementation of government's commitments, building capacity of NGOs, and creating a platform for dialogue and networking. Those are just some of our general objectives. I hope to show you how, in fact, we are planning, because we are in the planning stages for this, having just come out of a planning meeting with the Ministry of Health, in order to leverage our alliance for reducing obesity in the NCD Alliance. Okay, this is just, I thought I would just throw up when you're talking about alliance. This is what we use to guide coming together. Why should we come together? We wanted to be very sure that we were not trying to upset the apple cart in terms of what organizations do, but in fact to add value. And so we do have a set of agreed objectives. We have a work plan, and we see the mutual benefits of working on this. And we see this as a long-term relationship, not a partnership for a project, but a long-term relationship. In the past, there have always been the civil society involvement in the TTO, by the way, stands for Trinidad and Tobago in the UN acronyms, involved in things related to nutrition and physical activity, etc. I just put up some here. One, in the top one, we are particularly proud of. It was an initiative, in fact, started by a community, civil society organization, in which it worked with the Ministry of Transport, the private sector, Ministry of Health, for closing the highway in order to have, in fact, a free space and a safe space. And we've now got that into regulations. So now this is now after about 10 years, it's been formally put into regulations. There have been numerous, every weekend, you're sure to find somebody walking, running, or in a triathlon, sponsored by civil society organization of one type or another, or often with the private sector. And of course, related in the ban on sugar-sweetened beverages in the schools, the Parent Teachers Association, that should really be the NPTA, the National Parent Teachers Association, which is part of civil society, played a very important part, as did the Vendors Association, but not as much. In fact, we're now trying to find out more about them. And interestingly, the Diabetes Association has been working for quite a few years with the Ministry of Health and Nestle on collaboration on education in schools. And so we now have a reader and a quiz book, a reader, sorry, and for school, model book for the teachers, and there's an annual quiz, which is now grown into hundreds of children who participate in this. So just another way of the civil society working. So what are we hoping to do as we go forward? We see here that in our lives, we have relevant variety among the 9 founded NGOs. I will quickly stop them. Trinidad and Tobago Heart Foundation, Chest and Heart Association of Trinidad and Tobago, Heartbeat International of Trinidad and Tobago, Diabetes Association of Trinidad and Tobago, Trinidad and Tobago Cancer Society, and the Family Planning Association of Trinidad and Tobago. So we have site or disease or condition-specific NGOs, as well as we have 2 NGOs that are very key, and there are not many that are focusing on the risk factors. 3. One is the TANDI, which is the Trinidad and Tobago Association of Nutritionists and Dietitians. CSDA is the Caribbean Support and Development Agency, one of the few groups working especially at the policy level as well as at the community level in the whole field of physical activity, and the Tobacco Coalition of Trinidad and Tobago, which was formed some years ago. So those are the founding members. In addition to that, we have just inaugurated our network, which has more than 25 NGOs, including non-health ones. And this increases our reach within the community now substantially. It includes women's organizations, other professional associations, children's organizations, and one particular adolescent group that is working on health and wellness. Important is the fact that we are recognized by the Ministry of Health now, in what I think is quite a short space of time, as a voice and coordinator for NGOs. The Ministry of Health is finding it very difficult to coordinate 500 NGOs and how to deal with them. 6. In fact, one week, the Minister had 3 Cancer Society agencies come to see him. He was particularly then understanding of the relevance of an alliance such as the Trinidad and Tobago NCD Alliance. And so we've participated in not just the launch, but the development of the plans and the civil society meeting, and in the upcoming meeting on primary health care and chronic care model. We're trying to see how this can be brought together so that we all understand what we're talking about. We are participating in the design of it as well as the implementation. Sorry. Quickly, our work plan, in fact, specifically supports the Ministry of Health priority of reducing childhood obesity. And in our last planning meeting, the civil societies asked us, please, to build capacity in advocacy, campaigning, and project writing around this particular area. They don't have this capacity right now. We hope to promote informed, proactive, and coordinated engagement by the private sector. We're working with them, and we hope to have, in fact, a big event at the end of the year with them. We are going to support the National PTA to be engaged as a key stakeholder in this obesity initiative, because often the Ministry of Health will engage civil society around a particular activity or project, but not in a general sense. And so we see our role as facilitating that. And to ensure input from the civil society on numerous relevant policies, we have about 8 related to nutrition and physical activity now within the planning stages. So for the first time, we can in fact formalize that input of the civil society.
6 minutes plus, we're trending in the wrong direction. Okay, so now I'm going to invite Ms Tashaine Morrison, UWI.
Good afternoon, everybody. I am on the severe expression because it's kind of quick. Don't think I can do it, but I'll try my best. So I'm addressing the issue of childhood obesity, and I'm presenting the findings from a recent study which focused on the effects that a media literacy program has on youths and their mothers. This is led by Dr. Farquharson from the University of Illinois and Professor Julius from the University of West Indies Open Campus. I must first acknowledge our funders, the U.S. National Institutes of Health and the Christopher Family Foundation. So I'll start by outlining the Just Media program study. I'll describe what the words mean. So the J there stands for Jamaica, the US for United States, and the rest focus on media literacy. As you are aware, unhealthy eating is a major modifiable risk factor for obesity and multiple associated non-communicable diseases which are rising globally. The Caribbean has the highest NCD rates in the Americas and has targeted healthy eating, especially among youth, as a high priority action. So we found that some Jamaican youth and their mothers, they're internalizing American culture, but they're doing it in a way that they don't really understand, and that can form unhealthy eating habits. So remote acculturation here, we have an example where a student said, my culture, I don't know, my body is in Jamaica, but my mind is in America. And the mother says, Jamaican culture is changing, we're embracing a more American way of life. And these have actually been mentioned in journals, both locally and abroad. And at the bottom here, I'm going to explain these cogs. So it shows the link between remote acculturation, a high consumption of US cable, and I'll be very careful when I say one of the many factors that can contribute to unhealthy eating. So because we know that they do have a high consumption of US cable, we wanted to focus on media literacy as it relates to food. So what is food-focused media literacy? And this is the process to critically assess messages in advertising and the successful campaigns that actually exist in the US for students and their mothers. We find that it's not really focused on in Jamaica. So we wanted to provide that program for the students. So we enrolled 92 7th graders and their mothers, it's dyads, and we had 2 weekend workshops. And at the workshops, we taught them how to analyze these messages. We asked them what they ate, and we had supplementary text messages afterwards. So our media specialists from the US highlighted the successful US-based interventions that exist in the States, and we adapted a few for the Jamaican context. So we used the Ministry of Health guidelines to describe healthy eating, and we explained remote acculturation theory based on our prior research in Jamaica, the media literacy training that was very Jamaican focused, and the follow-up text messages that reinforced the key themes at the workshop. So I'm going to briefly go through the points of just media from A to E, and we'll start with the nutritional guidelines. So this is what we really showed them, and it was the portion of the food place that they're supposed to eat. And we asked, how many foods from the food groups do you actually eat daily? We also focused on advertising, and these are billboards that are found around Kingston. Yes, we drove around Kingston and took these pictures, and this is a clipping from a newspaper ad. So we wanted to show the local advertising, what is being advertised here in Jamaica. And again, the negatives of remote acculturation. So this is a mother who's saying the fast food is taking a toll on them as if they're Americanized. And a student who's saying he's American or she's American because they love advocacy, they love Instagram, and they like fast food. So to them, that is being American. So we also wanted to show them that the food ads, they do target you. As much as you don't realize, they do target you. They target teenagers and their parents, they target Black youth, and they also target low and middle income countries. So by point 2 and 3, we know that the Caribbean, we are very vulnerable to these. We also show them the persuasion tactics, so the repetition, celebrity endorsements, and the appeal to emotions that these companies use. This was the most receptive part of the program, I can say. So you see, this is advertising. So it's making fun of the ads or spoofing the ads. so that they really know what the ad is saying to them. And here from the scribble profit on the low to say Coca-Cola love profit. So we know that change is a process, so we didn't expect them to come to the workshop and change immediately. We just asked them to identify where on the change, the stages of change that they are. So if they're at the I don't want to change, how could we get to the I may try to change? And if they eventually get to the I've made a new habit, how can we prevent them from relapsing to the I don't want to change? This here is the efficacy study. So this is the entire team for year one. Well, not the entire team, some of the US team and the entire Jamaican team. And as I said, we enrolled, we screened over 800 7th graders, but we only enrolled 92. And we had 3 groups. So we had the control group who received the questionnaires and the 24-hour study, 24-hour recall, who recalls. The intervention group was split in 2. We had group 1, and they received the recalls, the questionnaires, and the workshop. Group 2 received the questionnaires, recalls, workshop, and 8 weeks of text messages after the workshop. So we move to the preliminary quantitative findings. And this is the first variable, which is the food consumption. We asked, do you currently eat 3 servings of fruits every day? These were the options. No, and I do not intend to. No, but I'm thinking about it. No, but I'm planning to. Yes, I have been eating 3 servings for less than 6 months. Or yes, I've been eating for 6 months or more. And because we had 3 groups, but because the food consumption, because that was actually before the text messages, we pulled the 2 intervention groups. And that's represented by the green line here. The control group, who did not receive any training at all, they're represented by the blue line. And they started out very closely before the intervention. And you can see that by the end of the second session, that the intervention groups, they reported having far more fruits daily than the control. The second variable, which is the media literacy. So these were the questions that we asked. These were the options. This is the result. So because this was after, this included after the text messages were sent, we split the groups. So the blue is still the control group. The green line represents those who did not receive the text messages, and the yellow or orange line represents those who did receive the text messages. And we can see that it's after the first workshop and the second workshop, both intervention groups reported having the same amount of media literacy. But those who received the text messages afterwards, they maintained that difference between the ones who did not receive the text messages and the control. So the qualitative findings. This wasn't a surprise because this was the most engaging part of the workshop. All students and mothers looked surprising. I wish I could show you it because they were very creative with it. There was one where a mother was eating fruits and vegetables and her son was eating Burger King, and he started complaining about his stomach. And she started doing the butterfly to say how she feels energized and happy because she just eats her fruits and vegetables. All right, so what are the implications? We found that the program really helped these families, and mainly, we think because the students were involved. We don't have a lot of programs that involve the students and these were 7th graders. So we found that when we were doing the 24-hour recalls and we called the mothers, there would be a child or a husband even in the background saying, remember to tell them about the cupcake that you ate. And the mother would say, no, but it was unhealthy. And they would grab the phone and say, Miss, she ate a piece of cupcake today. So the students really did try to keep the parents on track. And if the mother was cooking, they would say, no, remember not to put too much oil in there, less sugar, less salt. So the kids were really into this program. And that's just what we wanted to share today, to say that whatever's moving forward, whatever efforts that we're trying to put into preventing and controlling NCDs, we have to educate the children. So we have to keep them involved from the ground level. That's it. Thank you.
We're not even going to disclose. Maisha.
back my presentation. Time. This is our Childhood Obesity Action Plan that we developed in 2017, which runs through 2021, and it's meant to provide a framework for civil society action in the Caribbean in response to the epidemic of childhood obesity. So we have a number of, we've got priority areas. The first is trade and fiscal policies, nutrition literacy, early childhood nutrition, marketing of healthy and unhealthy foods and beverages to children, school and community-based interventions, resource mobilization, and the M&E component. And there are a number of partners that we're working on to implement various elements of this plan: the Caribbean Development Bank, AHO, and most recently the Global Health Advocacy Incubator. These are the grantees on our CDB grant. There are 5 civil society organizations who are here today: the Breastfeeding and Child Nutrition Foundation of Barbados, the Cancer Society, the Belize Cancer Society, Heart Foundation of Jamaica, and Farquharson Foundation of Barbados, and Fiona shared a bit about that. And in essence, they're all working towards one policy, which is around school policies to ban SSBs in schools, and in some instances, other unhealthy foods. And in the case of the Breastfeeding and Child Nutrition Foundation, they're working on workplace policies to support breastfeeding. So I'm going to share with you some of the work that we're doing under these projects. This is something called My Healthy Caribbean School, and it's based on an initiative which was done in Mexico through El Poder, which is really the organization of the Alliance Coalition of NGOs that came together to push for taxation in Mexico. And what they did was they said, okay, well, now we have this policy, we're going to put the power of the public, we're going to put power in the hands of the public to really monitor schools and see if they're actually implementing policies. Are they removing unhealthy foods? Are they removing unhealthy drinks? Are they promoting healthy atmospheres or exercise? So we adapted this program for this initiative for the Caribbean. It's called the My Healthy Caribbean School Initiative. And it allows, in the first instance, 5 pilot countries, those countries that are part of the CDB grant, to go onto a website, and anybody going to any of those schools can click on which country you're in, what's your school, and then you've got a series of 10 questions which basically ask you about your school environment. Then you click submit, and it will feed back whether your school is a healthy environment or not a healthy environment. And then you can go to take action here, and you'll see a number of steps around how you can improve your school environment. The second piece that we're working on now is developing guides to support the recommended actions in these schools. We're doing that in partnership with stakeholders so that they are meaningful and they're actually used. That's the My Healthy Schools initiative. We're also about to launch, these are just basic fact sheets. So they're meant to be tools for our civil society partners in each country to have at their fingertips basic childhood obesity data. What are the levels of childhood obesity within their country? What are some of the risk factor behavior related issues? So are they drinking soft drinks? Are there fruits and vegetables available? What are the sedentary habits and what levels of physical activity do they have access to? Are they engaging in? And so we have one of these for every single country within CARICOM. And again, those will be accessible. Again, tools to ensure that civil society have information at their fingertips to be able to advocate for the various policies that we're pushing for under the prevention plan. This is the scorecard we spoke about earlier. This is the petition that Francine launched. And that summarizes.
Thank you, Maisha. That was very, it got us 1 minute back. We're grateful. Finally, we're going to ask Mr. Stephen Farquharson from CROSQ to give us his fragment.
Good afternoon, everybody. I'll try to be within the 5 minutes. And we're just looking at how CROSQ is facilitating the process of NCD reduction. So our mandate at CROSQ has to do with state facilitation, health and safety, as well as the environment. And we have just a bit of experience with NCDs and in developing the standards for tobacco as well as for prepackaged foods. Now, we learned a bit in developing the standards for tobacco. And this, the lessons learned here had to do with the issue of principles of standards development, which is transparency, openness, consensus, and relevance. And in trying to achieve that, we realized that our stakeholders were not very well understanding of these principles, and therefore we had some challenges. We had some challenges where stakeholders were not able to participate in the way we wanted them to participate, or not willing to participate in the way we wanted them to participate. Getting balanced representation, some persons felt that we should not have had the tobacco company participating because they are going to naturally try to bring down the standard. We have conflicts of interest, we had industry opposition, and again, that's, you know, expected. And then in terms of the compliance, having the standard passed, we did, however, achieve the standard being passed. And so to date, we are now trying to move forward in having the front of package labeling as a part of the standard, the prepackaged food standard. And that will be done with Suriname hosting the regional project team and supporting the process. We have CARICOM, we have PAHO, we have HCC and UWI and the OTN. And these persons are actually on our advisory committee. Now, the process has been fast-tracked, and with that, we should be completing this within 1 year and taking the best approach for standards development. Now, our process is an output of the 6-point policy from that CARICOM initiated some time ago. And just to indicate that our project team, with the advisory committee, will draft the standard and have it go through a technical review. We realized that we just need to add that front of package. Now, the front of package, I'm sure you're going to hear a lot about the front of package labeling. What it will do is highlight where we have a defined profile of what sugar content, salt content, or fat content a product should have. Now, if you see products from Chile, you'll see on the front of it, you'll see some little octagonal boxes with the high sugar or high salt or high fat content. And it's a warning to the consumer. Immediately as you pick up a package, you'll be able to tell whether or not this package is compliant with what we are trying to achieve. And therefore, we hope that this will allow our consumers to better purchase, or make better purchasing decisions and reduce obesity. Now, the other processes is our standard process. I won't go through it in the interest of time. This is for the project team members who will understand it quite a bit better. But just to say that at the end of it, we will have a document submitted to COTED for final approval. So once it is approved, what we need to have is the in-country implementation at the level, at the country level. Now, we're also developing a standard for nutritional labeling, and this standard will ensure that when a company produces a nutritional label, it's not just a download from the internet, where they just go on the internet, find, I'm selling soft drink, I just find a soft drink label, put it on, and my product has no bearing with what is on the label. We need to have that regulated, and so we're going to pull, currently it is in the standard, but it is optional, and we want to take it out and make it mandatory, and have it, make it validated by testing institutions. And this, however, will take, we expect that it will take 2 years, because for 2 reasons. One, some researchers will have to go into it, and 2, our labs will have to build capacity in our laboratories so that they are able to test the nutritional labeling, and that we have had some help from Alafia, supporting some labs. Well, not all of you. Okay, supporting our labs to achieve this. And we believe that our success factors must be that we have the framework that will guide what people should do. We must have the technical regulations to identify and to force, give teeth to the framework that we have in place. We must have testing facilities, inspection facilities, and certification services that will measure the competency of the persons performing these tests, inspection, and certification. And we need to have these bodies accredited so that they can stand the test of time across the world. Because we have situations now where products, test results are sent to our partners, our training partners outside of the region, and they are not accepting it. They take the product, they hold it on the wharf, and they're not accepting the result because it is not from an accredited institution. So we must have competent authority. We must enforce both administratively and judicially. We must make our people aware. And we are, at CROSQ, is willing to use our platform, integrated with all the other platforms, to have these successes. And that's basically where we want to go in reducing NCDs by harmonizing standards, putting in the policies in place, and building capacity in the region. And that's my presentation. Thank you.
I want to thank the panel for really trying to help us with the time. Thank you very much. And we're exactly 1 hour behind. Okay. Okay, Nick.
2 burning questions in the
Back.
Just very briefly to say, no. I'm struck by, I'm seeing all of these multi-sectoral partners. I'm not saying it may be there, but I'm just wondering the extent to which law people are involved in all of these projects and processes. It is critical that we not involve lawyers at the end when it's now time to draft legislation or to bring a case. Lawyers need to be there from the beginning, understanding the policy, helping you understand the parameters, the limitations, and oftentimes industry comes with wrong information. And then you draft your things in a particular way or change course, and it turns out to be completely wrong. But because there's no lawyers there, nobody knows better, you think that, and so that's my one burning point.
Thank you, Nicole. I see all of them writing what you're talking about, so they're taking notes.
I also just have a question, and especially around media. Quite a few presentations showed the creation of media products. And I'm hoping that through the coalition, we can find ways to share some of the media so we can use them.
Yes, I'm sure we can do that. Of course, the thing is the price to put them in the to buy the billboards and so on, but we'll come to that. So thank you all very much. We're only 1 hour behind time, but that means we're having a great workshop.